Casa Cultura. Yo soy Bianca Solis, and today we have a very special and familiar guest, David Briceño, the Director of Outreach and Corporate Compliance of La Casa Family Health Center. David, thank you so much for being here today.
Well, thank you for having me on. It's a pleasure to be here with you this afternoon, and I hope that we can provide our folks with a lot of great information.
Alrighty. So today we're going to be talking about chronic disease self-management and diabetes self-management. So what defines a chronic disease?
You know, chronic disease is one of those diseases that once you get it, once you contract it, it's not going away. Very seldom does it go away. Let me say that, because I've heard of people that say, well, you know, I got rid of my diabetes by doing this, this, and this. And I think they're still predisposed to it, but what they've done is they've taken control of it, like we're talking about here. Han tomado control de su enfermedad by exercise, diet, and all of those other activities that are going to make them live longer and have better health.
Alrighty, and then there's two types of diabetes. What's the difference between type 1 and type 2? Okay,
type 1 is the diabetes that you're born with. Okay, type 2 is one that you acquire later on in life, maybe because of you're predisposed because of genetics, because I think everybody knows that when you speak of diabetes and type 2 diabetes, you're going to find a family history of individuals having that in their families. The other thing about it is that there could be a major trauma in your life, and all of a sudden the next thing you know, you're diagnosed with type 2 diabetes. That has an impact on it. And your lifestyle. What do you eat? You know, do you exercise? Are you a couch potato? All of those things are important indicators of whether or not you're going to get type 2 diabetes as you get older. In my case, I was diagnosed after a major traumatic event in my life, and didn't know I had it. And so it was that type of event, plus it is hereditary in my family on my mother's side for individuals to contract the diabetes. So that's basically the difference between those two.
So what are, you know, the programs that La Casa is offering?
Well, you know, the first thing we talk about, and the reason why we offer these programs is this. If you take a look at anybody who has a chronic disease, and by chronic disease I mean diabetes, hypertension, high blood pressure, it could be asthma, could be chronic pain, all of those things are issues that are with you from the time you wake up to the time you go to bed and even while you sleep. I call diabetes a silent killer, because you don't even know you have it sometimes, and once you're diagnosed, you really don't notice anything different. If you don't treat it, you feel, oh, no big deal, I'm okay. But it's a silent killer, because as that A1C, or the sugar in your body, starts to go up, it begins to attack other organs in your body. Has an impact. You have a greater chance of dying from a heart attack or a stroke. You have a chance to look at kidney disease, because it causes issues there. So these are diseases that if we don't do anything about them, then we're going to die. And it's not going to be a beautiful death. And I don't know if any death is, but when we talk about it to patients, that's how blunt we have to be. If you don't address these issues, if you don't take care of yourself, then you're going to die. And you're going to die sooner than you should. So here's the number one thing. Number one, get under a doctor's care and follow that doctor's treatment plan for whatever chronic disease you have. And that's really, really important, because if you don't, then you're not going to get the results you want. Number one, they're probably going to prescribe some type of medication for whatever the chronic disease is. Follow the plan. Make sure you get those medications, make sure you take them the way they're prescribed, and make sure that if you have any issues, you go back and you talk to your care provider. Second piece is, start to research how you can self-manage some of the issues in your life. And that's what this is all about. It's about self-management of your own chronic symptoms and the importance of doing it. We latched onto this program called the Chronic Disease Self-Management Program that came out of Stanford University. And here's some reasons why. Number one, for the patients, it's patient-centered. It's all about that particular patient. They are taking a look at who they are, and what they need to do for themselves. Number two, it's active engagement. Each class is filled with different topics, and then at the end, they have to develop an action plan and say, I'm going to do this for the next couple of weeks to impact. And it's not about, hey, I'm going to lose 25 pounds. That's not an action plan. That's a goal. So we say, okay, within that, so that's your goal. So how are you going to get there? Okay, so this week I'm going to start by not eating any in-between meal snacks that are not healthy. So you eliminate the potato chips, the 2 candy bars, you eliminate the sodas, and all of a sudden you replace that with vegetables, a glass of water, those types of things, so that you can improve your health step by step. So it's active engagement in their own care. Then you take a look at group support, because what I find interesting as we put on these classes, and I've facilitated several of them, is that people begin to engage with each other. They make new friends, they meet people just like themselves who have those issues, and all of a sudden they say, you know what, let's get together and let's go walking. We'll meet at 6 o'clock or whatever time and we'll walk. Well, guess what, if somebody doesn't show, hey, where were you? I was waiting for you out there. Beautiful day to walk. And so they encourage each other to do those things that they need to do. So you get that group support. It starts to improve their quality of life. They can't imagine. I visited with one lady who hadn't done exercise for years. And really, she had no quality of life because all she did was sit at home. Didn't go out, didn't really socialize, she stayed at home. All of a sudden, she said, you know, I just started walking just a little bit, maybe just outside around the yard, and all of a sudden I met neighbors. Got to visit and talk to them. Then I started walking at the park. Met other people that were there. So all of a sudden, I'm feeling so good because I'm actually talking to other human beings and not staring at a TV all day. Or playing on her iPhone or whatever phone she might have at the time. So that's very, very important. It's also a gateway to additional support services. They began to learn through the class and through others where the resources are for the issues they face. You know, because it's not only about the healthcare. Maybe they're having trouble paying their rent, or they're on a fixed income and they have a food shortage in their home, or they may not have enough food insufficiency, which is a huge issue for many people. So by coming to the class and meeting other people and talking, they find out about other resources in the community that are available to them. Then they learn new stuff. You know, how can I exercise if I can't even walk? Well, you exercise sitting down. You know, you move your arms, you move your legs up and down, and you do that for 10 minutes. And then the next day or the next week, you increase that to 15. And then all of a sudden, you might find yourself with the ability to walk a little bit. And you just slowly take those steps so that you can improve your again, quality of life. And then they gain their active lives back. That's the beauty of what I've seen with the value of this program. It's an awesome, awesome program for those that take advantage of it and truly want to live it.
How many times a year do you guys offer this program?
We offer it various times throughout the year. We have a calendar of the times we were going to offer the certain classes. We can't do it. We don't have the capacity to offer the class every week. So what we've done is we've made a calendar and we say, okay, from this date to this date, we're going to offer the chronic disease self-management class. And then that's in Clovis. And then in Portales, we're going to offer, on these dates, we're going to offer the Tomando class, which is the Spanish version of the chronic disease class. And then in Roswell, we're going to offer, from this date to this date, we're going to offer the diabetes class. Because those are the 3 that we offer right now. And by doing that, then we have an idea of when we can tell people this is when we're going to do the classes. We try to offer each class in every community at least once a year. I mean, there's only like 1 or 2 of us in every community who can facilitate the classes right now. So we're trying to increase that by having a training class set up. I think we're going to try to shoot for maybe April. It's a 4-day training for anybody interested in becoming a facilitator. And if we're able to do that, that means that we're able to get more help, and maybe we can increase the number of times we offer the classes.
And who are the people who are facilitating these classes?
Well, the people that are doing that are all employees of La Casa at this time. And in Clovis, if people have any questions, they can call Yadira Reyes. She's a promotora and outreach worker there at 575-762-0739. In Portales, we have Maria Ibarra, who is at 575-359-3826. And in Roswell, we have my good friend Eddie Carrillo, and he's at 575-624-4115.
All right. Thank you so much for that information, David.
Okay.
We'll be right back after this short break.
All right.
Fue un placer conocerte y tenerte unos meses, aunque esos meses fueron el principio y el fin de un amor tan bonito, aunque no me quisiste, pero yo sí te quise y hoy me tengo que ir. Muy feliz fui contigo, me conformé con nada y hoy te quedas sin mí. Y a pesar de que nunca me dijiste te quiero, hoy que tengo que irme, me demuestras tu amor, me demuestras tu amor. Pero tengo que irme porque ya no te quiero, no sé por qué motivo, cosas del corazón. Fue un placer conocerte y tenerte unos meses, aunque esos meses fueron el principio y el fin de un amor tan bonito, aunque no me quisiste, pero yo sí te quise y hoy me tengo que ir. Si me hubieras querido cuando yo te pedía que me amaras un poco, que me hicieras feliz, yo me hubiera quedado para siempre contigo, pero no fue posible. Y hoy me tengo que ir. Hoy me tengo que ir. Yo me tengo que ir.
Welcome back to Cultura. I'm here with David Briceño, the Director of Outreach and Corporate Compliance of the Casa Family Health Center, and we were talking about chronic disease self-management and diabetes self-management. But you also mentioned to me during the break about the car seat program. Can you give us a little bit of information on that?
Yes, I can. You know, through Safer New Mexico, which is a department up there in Albuquerque or Santa Fe somewhere. We have been designated as a distribution site for car seats. And while we don't offer them for free, we offer them at a much discounted rate of like $20. And if you now, I don't know if you ever shopped for a car seat, but I have, because now I have grandchildren. Those suckers are the good ones, the safe ones, are running about $250
Oh, wow.
for an infant seat that they can grow into. To, you know, when you get the booster seats, it's only $30, but it still costs money. So we offer them for $20. And so what, as a distribution site, then what they do is they send a certain amount of car seats that we keep in stock, and then we make appointments with individuals who come in and say, hey, I need a car seat. It's very easy. All they have to do is go through fill out some paperwork, go through an education process of how to use the car seat, why they're important, and then the technician, who is either, you know, we have Yari Reyes, who I spoke about earlier, we have Maria, now Maria's just learning, and Erika Rio now in Roswell, who are car seat technicians. So they go in, they look at, if they have an older car seat, they look at it to see if it's still good. If not, they remove it, replace it with a newer one, teach them how to set it up. In fact, they set it up for them to make sure it's installed properly, and off they go. And hopefully the child is safer than ever. And I bring this up because I know that I just found out recently in Roswell, or in that area in Chavez County, there were a couple of young people who lost their lives. Unfortunately, I don't want to, you know, build on that tragedy, but one might have been avoided because the child was being driven around without a car seat. And so when you hear things like that, of course you say, come on, we can do better. We can, if we're giving them, because we basically, what we tell our staff is, if they show up and they tell you flat out, hey, look, I don't have 20 bucks, then give them the car seat. Because I could not live with my conscience telling me that that person drove away, and because I didn't give them a new, safe car seat, that they were in an accident, that child died. I couldn't live with that. So let's make sure we're going to give them to them, even if they can't pay. So all they have to do is call up, make an appointment, and we can get them a new car seat installed. And in fact, there's going to be car seat clinics throughout the region, especially now as the weather starts to warm up. I know that in Roswell, there's going to be one on February 10th, and it's going to be at Roswell Ford. They were gracious enough to loan us a bay. That means they're going to be able to do the installation inside, because you don't want to be out in that cold wind trying to install seats. So they're going to be inside installing seats as people come in. And so I think there'll be more advertising about that in the near future. And so we want people to go up and make sure that if they need a car seat, come on up, visit with some of our staff. And I can share the numbers with you again and post them up. But Yadi and Eddie are the ones to call at this time. And we have 2 more that are training, and will soon be certified to distribute car seats as well. But I think that's such an important program. I don't know, growing up, I wasn't required to sit in a car seat. In fact, it was okay for me to ride in the back of a pickup and without any kind of restraints or anything else. But that's not the case anymore. We have found that, of course, we want our children to be safe and to grow up and to become productive adults. And so take advantage of these programs if you're in need of one. And this is offered in Clovis, Portales, and in Roswell.
All right, another subject I know we wanted to touch on was the funding cliff. You know, what are the kind of negative impacts that our community health centers are facing right now?
Well, first of all, let me share with you what the funding cliff is. Back about 20 years ago, Congress provided federal funding to community health centers nationwide that would provide a certain level of funding so that they could provide access to health care to anybody that walked in the door. Now, we may not think that's important, but I can assure you that the research and the statistics show that community health centers are the most effective and cost-efficient way to provide health care to our communities. I don't have that data sitting right in front of me, but anywhere you look, you will find that that is the case. And it has been so for a number of years. I mean, La Casa Family Health Center, who provides services in Clovis, Portales, and Roswell, has been around since 1976, 40 plus years we've been providing this service. We've expanded our services to include, we started out with just medical services. We've expanded those services to include not only medical, but dental, and now in Roswell, behavioral health. All services that are critical to a community who wants to thrive and grow. And so we're very, very proud of that fact. Well, this funding that was provided 20 years ago ran out this year, or the law that authorized that funding ran out. And of course, we have a lot of support in Congress. Republicans and Democrats support community health centers in this nation because they see the importance of their existence, they see the services they provide, and they also see the research that shows, hey, they're very cost efficient and effective, and they provide access to health care to anyone that walks in the door. It's cheaper to come to our clinic than it is to go to the emergency room. So that's a given, right? So what has happened is this funding has run out, has not been reauthorized. And so what community health centers across the nation are facing are a 70% cut in their federal funding. 70% cut. That's going to mean that about 55,000 individuals will lose their jobs. Thousands of patients will lose access to health care because there's nobody going to be there to provide the care, because we're going to be, basically, some clinics are going to go out of business. I don't know the impact it would have on us if we would go out of business, but here's what we're facing. We currently receive about $3 million in federal funding. 70% of that is $2,100, $2,100,000. Guess where the cuts would be? It's not going to be in paper. It's going to be in staff, because that's where about 90% of our budget goes. And so we're going to see a reduction of staff, reduction of services to our communities, possibly the closure of clinics throughout the system. So it would have a very, very negative impact. One, on staffing. Two, on the patients that depend on us to provide them the care that they need.
And is there any way we can prevent this from happening? You know,
Well,
advocacy, talking to your local congressman?
You know, absolutely. I do have, going back to that, I mean, we've started the National Association of Community Health Centers has started an advocacy campaign, which began even last year and the year before that. I think the whole campaign started to roll to get the support that we knew we were going to need so that that funding would be reauthorized and we would continue to have support in Congress for community health centers. And so they started an advocacy program, and it's very, very simple to join. And so, for example, you can join here in about 5 seconds, and all you have to do is to sign up is to text the following to a certain number, but it's HCADVOCATE, HC Advocate, and you text it to the number 52886. That automatically signs you up as an advocate for community health centers.
Oh, okay.
Here's the importance of that. Congressmen, senators, any elected official listens to people who take the time to communicate with them, whether it be through a text, an email, a phone call. They count them. They begin to see, hey, all of a sudden they're getting, let's say in one day they get 1,000 calls, emails, texts from their constituents that say, hey, we need you to support our community health center. They're going to take notice of that. And this, our national organization, NAC, we call it NAC for short, has made it very, very easy to become that advocate. Here's what they'll do. Once you text them that information, you're going to be able to, you're going to put in this system, so when there's an action alert, and an action alert is very simply, they're asking us to take some type of action. It'll go, they'll text you and say, please email your congressman and your senator. And your senators, excuse me, because you have two senators and one congressman that you would communicate with. And so what happens is they show you the email. Here's the email we want you to send. You read it. If you like it, you push one button, and it goes off to all of your congressmen. And it goes off to your senators. So in our case, for example, here, our Congressman Ben Ray Lujan would get an email or a text. Senators Tom Udall and Martin Heinrich would get their text from us because they're our senators, they represent us all. And then if you're in Roswell, certain parts of Roswell, then Steve Pierce would be the congressman that gets the text, you see? Yeah. So it's very, very simple, but so they do it automatically for you. And we certainly do want people to join us as advocates in southeastern New Mexico so that Congress does get the message. We need clinics like La Casa. There's others throughout the state of New Mexico. We're just one of about, I'd say there's about 22, 23 clinics or clinic systems in the state of New Mexico that provide these services. All of them will be hurt if this funding is not reauthorized. So
we started the first half talking about chronic disease self-management and diabetes self-management. You know, the classes that you guys are offering because you guys adopted them from Stanford University. You know, would programs like that be cut for sure?
Absolutely. That would be the first thing to go. Because those are, even though they're providing services to patients, they're indirect. They're not providing direct care to that patient, taking a look at him and saying, okay, I'm going to prescribe you this, here's your treatment plan, go on. So absolutely, those would be some of the first to go because they're non-essential.
And then you also, you know, you talked about Roswell finally has behavioral health as well as dental and, you know, healthcare. So, like, you know, Portales ever expanding to behavioral health would be a no-go.
For now. I mean, how can you go if you don't have the funding to do that, or if you have no hope to get that funding? I know that our management team, our board of directors would love to see the expansion of behavioral health services to Portales and to Clovis. We have ties with the schools in Roswell where we're providing a person that goes in and provides counseling at each of the high schools to those students who are requiring it. You know what? Our schools here, I think, would love that type of support. We have lots of kids who need help and aren't getting it. Not because people aren't there that don't want to give it, it's the capacity to give it is not there. We don't have the staffing to do it. And so that's some of the issues that we're dealing with. And the funny thing about what's going on now in Congress is that we're debating about issues that are being raised that are, to me, non-essential to what's happening in this country. But for whatever reason, we've become this us versus them mentality, and we're having to deal with that at the national level. And hopefully they can overcome some of that, come to some compromises, help the dreamers, help fund the CHIP program, which is critical. Thousands of kids would lose health care if that CHIP program is not funded. And I think it was just, there's a continuing resolution that passed that would allow that to continue, I hope, for the next 6 years. I'm not sure if that actually was part of that package that passed today. But let's hope that it is, because those kids need it. So all of that together.
Even like the summer lunch program would be cut as well.
That I don't know. That's all different funding, and I'm not sure where they're at with that. But I do know that it's important that we let our congressmen know what we feel, what we think. Whether you agree with me or not, contact your congressman, get registered to vote, register others to vote, and make sure that you get to the polls, because that's what they listen to.
Pues, muchísimas gracias, David. Thank you so much for being here. I hope you enjoyed your time. I hope you like being back.
I do enjoy. I like being on this side. I don't have to prepare as much.
Oh, no, it was great having you. And thank you so much, guys, for watching. I'm Bianca Solis, and I'll see you next time.